Hello, my name is Travis Mader, and my podcast today will be about eye movement desensitization and reprocessing. This is a therapy method that was first developed in 1989 by Dr. Francine Shapiro. This is a therapy that is often used to treat post-traumatic stress disorder, but has been tested on other mental illnesses as well. Eye movement desensitization and reprocessing, shortened to EMDR, is similar to trauma-focused cognitive behavioral therapy in the way that both resurface and focus on traumatic memories. So the analogy that I found in one paper is that, like a wound that keeps reopening, a memory that is continually associated with negative feelings will never fully heal. And so the goal or the aim of trauma-focused CBT or EMDR or other exposure therapies is to, in the words of one paper, quote, focus on re-elaborating traumatic events or memories, favoring the emergence of new positive attitudes at the behavioral and cognitive level, leading to fear extinction and habituation. What this means is that by resurfacing the traumatizing memory and creating a new neural network around it, we have created an opportunity in which we can instill positive attitudes that eliminate a fear response and reduce the physical symptoms that are experienced by the patient. However, EMDR and TFCBT differ in how much time they spend recounting and reliving such traumatic memories. And of course, EMDR intersperses these memories with the eye movement directed by the therapist. Now, the theory behind all kinds of exposure therapy is well established and rooted in psychotherapy and its emphasis on childhood trauma. However, in psychotherapy, there's a belief in transference that is not present in EMDR. The key theoretical difference between TFCBT and EMDR lies in the reason that traumatic memories exist. TFCBT believes that there is a pathological problem that is allowing negative feelings to persist, and that to overcome this, you need to undergo extensive therapy. Whereas EMDR believes that the actual issue is a mechanical one inside the brain. EMDR believes that trauma stems from unprocessed memories. So to use the wound analogy again, TFCBT believes that the wound has healed, but is badly scarred, and is in need of some sort of operation to sort of undo that scarring. Whereas EMDR believes that the wound is still completely open, and that without healing the memory, the wound itself will never close. If the theory behind EMDR is correct, and what we are experiencing when we experience trauma is a mechanical problem, then the eye movement should in some way be unlocking a mechanism that would be identifiable in experimentation and in brain imaging. The theory believes that by emulating REM sleep like this, we're stimulating the brain in a bilateral way similar to dreaming that allows memories to be processed in a healthy way and then become less emotionally evocative over time, as normal memories are. It's theorized that this bilateral movement from one side of the brain to the other allows a deeper recall of memories, and or it could be affecting working memory in such a way that makes recall less unpleasant, like a dream. Another hypothesis, postulated in a 2018 paper, theorizes that the eye movement may actually activate the default mode network and cerebellum inside the brain, which operate the processes of memory retrieval, associations, and relaxation. So what does the process of EMDR look like as a patient? There are 8 phases that I found described in the Encyclopedia of Psychotherapy. In phase 1, the client history is gathered and a treatment plan is developed. This is done similarly to a standard psychotherapy session. However, the information gathered by the therapist dictates which memories are targeted for the therapy, and a plan is addressed to target those memories. In phase 2, preparation is done. A client-therapist relationship is developed, and the client is, quote, stabilized by engaging in their strengths and determining triggers to avoid that could make treatment ineffective. Phase 3 is the assessment phase. Here, the target memory is selected, and the client is encouraged to replace negative self-talk associated with this memory with the positive variety. The idea is to set goalposts for the client so that they have an idea of where they will end up when the traumatic memory has been reformed. Phase 4 is the desensitization phase. Here, the client thinks about the traumatic target memory while also following some sort of therapist-led stimulation with their eyes. It can be a laser pointer or a light or some other physical stimulus that guides the patient. The aim here is to create connections. Very little speaking is done on the therapist's part beyond promptings of, like, what do you see now? What do you feel now? What's going on now? Phase 5 is called the cognitive installation phase. Now, as the theory goes, that the memory is sort of diffused through new connections in the brain, the goal is to install the positive thinking from phase 3 into the new network of memories. The goal here is to go from maybe knowing something logically to actually feeling it. So, for example, a victim might know logically that they're not to blame for what happened to them in their traumatic past. But the idea here is to actually get them to feel it and to believe it. Phase 6 is called the body scan phase. In this phase, the client remembers the target memory again, recalls it, and tries to see if they have a physiological response, which is very typical when recalling traumatic memories. Phase 7 is closure. This is when the therapist and the client assess together to see if the treatment has been successful. And then phase 8 is reevaluation. This asks sort of more broadly if this therapy worked. Questions asked may include, did it work? Did it work completely? Does the client need more sessions? Or does the client need a completely different type of therapy? So it may have occurred to you by now that there is a bit of controversy around EMDR. Because of its novelty and its theoretical nature, there's a lot of people that wonder if EMDR actually works or if this is just sort of hypnosis by another name. Studies have found that, yes, in fact, EMDR does work. In fact, it's just as effective as trauma-focused CBT, which is considered the gold standard of PTSD treatment. The question is, does EMDR work because it's just another exposure therapy, or does it work because of the eye movement? One meta-analysis that I found compiled 87 different studies and found that the eye movement did not seem to influence treatment effectiveness. The study did find that patients felt more relaxed after EMDR, but they found this to be no truer than patients who had undergone other therapies that used distracting tasks, such as drawing or moving objects back and forth. Basically, the bottom line is there is no strong evidence that the eye movement has any neurobiological effect at this point. One blog post I found that reviewed several different articles about EMDR said this: psychologists who had experience with the cognitive behavioral treatment recognized many of the components of the new therapy. The only difference they saw was the addition of the eye movement feature, EMDR's defining characteristic. End quote. Despite the lack of hard evidence to confirm the theories behind EMDR, the good news is that EMDR is effective when compared to placebos. In fact, the technique even seems to hold up against TF-CBT, which is considered the gold standard of PTSD treatment. So yes, EMDR is an effective treatment. Outside of PTSD, though, there's little evidence that it helps with things like depression or anxiety. A meta-analysis I found from 2019 found that there was insufficient evidence to recommend it as a treatment for anything besides PTSD. So, to conclude, I will editorialize a little bit and say that I picked EMDR because I was skeptical of it from the outset. I cannot say that, looking at the research, I am any more convinced that the eye movement is anything more than a gimmick. Although it seems possible that the orchestrated eye movement is contributing to the neurobiological mechanisms that create memories, I remain skeptical about how a facilitated eye movement could really recreate the effects of rapid eye movement that we experience during our dreams. I'm heartened to know that EMDR works, even though it probably only works because of its CBT-like quality, but this is not something I think I would really recommend to others.